Hi, good evening. I am Dr. Felice, your hopefully friendly and now familiar integrative OBGYN doctor. I'm here to join you tonight to continue the talk that I gave a week ago, which was on what are oral contraceptives and what are their risks and what are you really putting in your body when you swallow that pill, put on that patch, or put in that ring, because they're all just different delivery systems of chemical endocrine disruptors. Now we're going to move to another area of female contraception, and we're going to talk about the IUDs, intrauterine devices. And what are they? And what do they do to your body? Should you use them or should you not? But first, let me just tell you, for those of you who are new to this program, to Zubia, to my talk show, that I am here a couple of times a week, and maybe it'll be more often as we just grow and create more programs. I'm here to help you to understand what it means to be in a female body and how you can maintain your body to be the healthiest it can possibly be. And I do that using the safest and most efficacious tools, because as an integrative doctor, I look at the body as a whole, and I look for ways for your body to harness its own internal intrinsic mechanisms to stay healthy, and only use pharmaceuticals and surgeries and such when they're absolutely necessary. And when we use pharmaceuticals, to use them for the shortest time possible, because understanding that pharmaceuticals are never natural, they're never designed to be in a human female or anybody, and they work on different kinds of pathways in the body, and they always have side effects, because nothing in the body only works in one place. Everything is multitasking, everything connects to everything else. So that's what an integrative gynecologist, myself, is all about. So coming back to our show tonight, let's talk about IUDs. There was originally plastic IUDs. They were called Lippes loops, and they came in a couple of different kinds of designs. Lippes loops were the most common. These go back a few decades ago, but they were sometimes not effective. Sometimes they didn't work. Sometimes they fell out, and they were replaced over time by a different generation of intrauterine devices. These are designed to prevent pregnancies. They're contraceptives, and there was what was called a copper 7. Unfortunately, or fortunately, depending on your perspective, there were many lawsuits involving the copper 7. The company stopped distributing them and selling them in the United States, though they were still around in other parts of the world. But they stopped in the United States, and there was a big gap when there were no IUDs. Then, well, let me backtrack actually a minute. There was a huge problem with IUDs back in, I think it was like in the 1970s. And that was using an IUD called the Dalkon Shield. This was a plastic device that looked kind of like a shield, like if you were protecting yourself in battle, like if you were a Roman soldier. And they called it the Dalkon Shield. And this caused terrible problems for women. Women lost their female organs. They had severe infections, abscesses. It was just catastrophic. It turned out it wasn't because of the IUD itself. It was because of the strings that they attached to them. Every IUD needs to be removed at some point. And so they attach a string so that you can pull it out. It's that simple. You just pull and out comes the IUD. So unfortunately, with the Dalkon Shield, the type of string that was attached was what we call a multi-filament thread. And because of that, it acted like a wick. And if there were certain kinds of infections in the female vagina, the IUD string would wick it up and would take it right up into the pelvis and create a catastrophic pelvic inflammation and infection that sometimes led to surgeries and sometimes to complete hysterectomies, removal of even the ovaries. It was just catastrophic. Many women ended up becoming sterile or from the infections, from scar tissue, or from having surgical removal of female reproductive organs. So the IUDs really fell out of favor for quite some time, and then they came back to life with the copper 7, and then that one also disappeared. Then onto the scene came the copper T, and that was quite popular and still is. It's called the Paragard. It's still around. It's still very popular. And there have been some other IUDs. There was a short-term IUD that only lasted for a year called the Progestocert using a progestin, and then that one disappeared as well. Now we have other IUDs that are embedded with these chemicals called progestins. That's a man-made word that is for a chemical endocrine disruptor that predominantly involves the progesterone receptors. And there are, I don't want to really name all the brand names, but there is one that's been on the market for quite some time, and it is embedded with a type of progestin called levonorgestrel. That's the one that's used, and it's an endocrine disruptor. Okay, if you go to PubMed, if you look it up, if you look at the toxicology websites, if you look at the environmental medicine articles that are published, levonorgestrel is unquestionably an endocrine disruptor. Okay, so what does that mean? What is an endocrine disruptor? It is a chemical that will bind to receptors and alter the way that the normal receptor would work, and you would get a different effect. They can have other effects. They can affect how a hormone is produced, how it's distributed around the body, how it's eliminated. So it can affect every single aspect that is involved with the life of a hormone. An endocrine disruptor can interfere with. And levonorgestrel can have impact on receptors besides just progesterone. It can impact on testosterone receptors and also aldosterone receptors and so forth. So it is multitasking as an endocrine disruptor. But it is quite effective. This type of IUD that contains this progestin, this levonorgestrel, is quite effective at preventing pregnancies, as is the type of IUD that contains the copper. They are both quite effective. In fact, the chance of getting pregnant with them is not zero. Even when they're properly inserted and properly in place, it's still it's less than 1%. But I've seen people get pregnant with both of them when they were in place in the right place. But so they're not 100%, but they're very effective. So why am I even talking to you about these? Because there are some things that nobody does talk about with them, and I need to talk to you about them, because what my goal is with all of my patients and with you out there is for you to make a choice based on knowledge and real information, because everything that you do in life is based on risk and benefit, right? Everything. You have to think, is this more beneficial or more risky? Which should I do? Is it? And we have to apply that to everything. We've talked about that with mammograms. What's the risk benefit with a drug benefit? So getting pregnant when you don't want to be pregnant is a big risk, and it's a big harm. So of course we don't want women to get pregnant when they're not ready. That isn't what we want at all. What I want is for people to recognize, and we're going to talk more about this. I talked about it last week with the birth controls. What I want is for people to be able to have options, women to have options, couples to have options to prevent pregnancies that don't interfere with primary critical pathways and functions of the female body. And that's what we're doing. So let's go back to the beginning for a moment. What is reproduction all about? We don't want to have reproduction happen when we're not ready for a baby, but whether we like it or not, reproduction is not like an added on, tacked on feature to a female body. It's integrated into the entire whole of the female body. So when you interfere with reproduction by interfering with major functions and pathways in the female body, you're interfering with metabolic functions that are going to impact on every other organ system in her body, because they're all an integrated whole. And this is really important, and people are not grasping this, that you can't just shut down reproductive functions and not have huge potential for collateral damage. And I use the word potential because a lot of these things have really not been studied. And so I can't even quote studies and tell you the numbers on this, that, and the other risk. All I can talk about is potential risk. And we need to think about this because most people are not. So when we recognize that reproduction is not this added on feature that is sort of separate, we can just sort of take it away or play with it, and it's not going to affect anything else, then everything becomes very crystal clear. Once you recognize that hormones like estrogen, progesterone, testosterone, that these are not just reproductive hormones involved in the creation of menstrual cycles or periods, they're not about that alone. They are about survival, about every metabolic function in the body, about maintaining the musculoskeletal system, the cardiovascular system, the cerebral system, our brain function. It's about every single organ system in the body has receptors for these hormones. So when you put in endocrine disruptors, then you're going to impact all of them. But wait a minute, you may say, what about the copper IUD? There are no hormones in that. And in fact, that is, to me, a big plus. But let me ask you this. What did I just say? That's wrong, okay? I said this because I wanted to see if you even picked up on it. I said IUDs with hormones. That's how they're referred to, but they are not hormones. They are endocrine disruptors. A hormone is the identical substance that the human body makes. The human body does not make levonorgestrel. It does not ever naturally exist in a human body of any gender. It doesn't exist in any creature that lives in any part of the earth, okay? So it is not a hormone. It's a chemical endocrine disruptor. It can bind to receptors, but it has different effects. It affects the production, the distribution, the everything about hormones. Okay, but let's talk about the IUD that doesn't have hormones. This is the IUD that I use the most in my practice. In fact, I will not use the other ones because I know too much about them. I just don't feel comfortable using them. The IUD with the copper, I do insert, but I do have to recognize that there are negatives, even though there are no hormones or endocrine disruptors in that type of IUD. So what is a copper IUD and why would they put copper in it? Well, remember I mentioned there were these earlier IUDs, the Lippes loop. They were just copper and they had a failure rate that was not acceptable. So we don't want people to get pregnant with an IUD in place because that's actually can be life-threatening. You do not want to, it can get terrible infections that can be very dangerous. So that we do not want to have happen. So they tried to make a more effective IUD and they put copper on it. So what's magical about copper? What is it about copper? Well, copper is very inflammatory. In fact, many cancers are associated with high copper environments. And this concerns me because here we are, we're putting a high copper environment into a uterus, the purpose of which is to prevent both ovulation, I'm so sorry, I didn't mean to prevent fertilization. I hope you caught that. It does not, that's the benefit of it. Unlike the other IUD that has the endocrine disruptor in it, it does not affect ovulation. So you will make your hormones naturally and they will not be interrupted. So it does not interfere with your own body's hormones, but it can affect fertilization. And that's what we hope it does. Nobody really knows exactly the mechanism of a copper IUD. And some people think, but we have no proof of this, that it may not prevent, in every case, fertilization. It may prevent implantation. Well, and then some people think that if you get a fertilization and you create even the earliest stage of an embryo, but you then don't allow it to implant, that is a form of an abortion and they will not use IUDs. And so I do know of doctors who will not use IUDs, patients who will not use IUDs because they consider them to be a form of an abortion. But that is not universally agreed to, but it's really hard to prove one way or the other. But probably in most cases, the copper IUD prevents fertilization, and it probably does so by harming the sperm right out the gate, because copper is going to be exposed to the sperm as they come through, and the copper probably damages the sperm because it's inflammatory. It probably makes it so that they can't fertilize, and they probably don't even swim properly after that point. So that's probably the mechanism, is that it's really bad for the sperm. But it's also inflammatory for the environment of the uterine cavity. And this is what I'm concerned about. What kind of long-term implications can this have for the woman? So they say that the amount of copper in it does not actually impact on the amount in the woman, that it doesn't get absorbed systemically to any significant degree. But they do have a warning that you should not have the copper IUD if you have a disease that's involving copper storage, where you store too much copper. That's called Wilson's disease. So just the fact that they say that makes me feel concerned, that someone is thinking, well, maybe you do absorb that copper and it does distribute through your body. So that's a worry. We don't want copper. We need copper, actually. It's an essential trace mineral, but we don't want to have it in large quantities. Everything has a sweet spot. We want just the right amount of copper. We don't want too much. That is an inflammatory situation. So we now know that when you have a copper IUD inside the uterus, it causes inflammation in the uterus. It probably causes inflammation in the ovaries, and it changes the vaginal environment as well, and probably changes the environment of the cervix. There's no reason to think otherwise. So it creates an inflammatory state that includes all of the female pelvic reproductive organs, possibly even the ovaries. We just don't really know. But we know that women who have a copper IUD in place have more vaginal infections. They have bacterial vaginosis more. We now know that bacterial vaginosis is an increased risk factor for women to have pregnancy complications like preterm delivery, and can also impact on fertility. So I am very concerned about what the long-term implications may be of using the copper IUD on the microbiome. We now know that everything has a microbiome. The uterus has a microbiome. That means bacteria live everywhere. And you have specific types. You're supposed to have certain types and not other types. And we now know that the inflammatory process of the IUD changes the vaginal microbiome, the cervical microbiome, the uterine microbiome, the tubal, and probably the ovarian microbiome. And what that means long-term, we do not know. Short-term, we know that it increases vaginal infections, and I do have concerns knowing now that it affects the microbiome of the uterine cavity. If that's removed, if the microbiome cannot repair itself, which it can't always do, then you can end up with an abnormal microbiome in the uterus and on the placenta, and that could lead to pregnancy complications. So that's where it stands as far as that part. We know there are standard risks and so on with the copper IUD. Some women have more cramps, heavier bleeding. So those are known ones. I'm not really I don't want to focus on the known risks. I want to talk about the ones that people aren't talking about, like the impact on the microbiomes of the female genital tract. All IUDs have certain risk factors. For example, you can perforate the uterus if some doctor puts it in, or a nurse, and they put it right through, so it perforates. So that can happen, or it can get embedded. It can actually work its way into the wall of the uterus, or it can fall out when you don't know it. And then, of course, that can lead to potential pregnancy. So now the progestin type of IUD that has the levonorgestrel in it, that particular IUD has also been stated that the IUD can actually migrate across the wall, actually work its way through the muscle wall of the uterus into the peritoneal cavity, actually work its way out of the uterus, even if it's put in correctly in the first place, which is like crazy, phenomenal kind of thing to think that it could work its way right out of the uterus. But that has been stated, and there are cases where they say that's been documented. So what about the IUD with the levonorgestrel? What am I worried about with that? Well, I've already explained I do not like endocrine disruptors put into the bodies of women because they interfere with the normal hormones and the normal function of a female body, which involves both reproductive functions and a million and one other functions, because we know that these hormones, the real hormones of a female body, are multitasking and doing many, many, many things all over the body. So what about levonorgestrel am I concerned about? Well, we do know that it's been associated, and now they have warnings that it can cause what's called intracranial hypertension. Sometimes they say idiopathic, which just means we don't know why, but if it's related to the IUD with the levonorgestrel, I think we do know why. But so this is a potentially even life-threatening condition. It's a very serious thing if you get this pressure in your head called intracranial hypertension. Other things, this is a chemical that we originally, when this IUD was first marketed, we were told, oh, don't worry, it doesn't get absorbed into the bloodstream. It's just local, it just stays in the uterus and changes the lining of the uterus so you can't have proper function. And it changes everything so you don't get fertilization, so because it changes the way the tube works, because the tube has to have, the tube actually has peristalsis. So it actually moves, and so it can pick up the egg. It can then work with the sperm and all that is then hampered, supposedly. And that's what the levonorgestrel does to prevent pregnancies. So the problem is that that wasn't true. We now know that this chemical levonorgestrel is absorbed, and you get systemic levels, you get blood levels that are very similar to blood levels of women who are taking similar compounds that are in birth control pills. So you get a systemic level. And as such, in a fair number, over half of women, they stop ovulating. So they're not making estrogen properly. Their whole menstrual cycle is completely shut down. So they are not getting normal hormones. They don't have the rhythm of hormones. So this really impacts on everything, on brain function, cardiovascular health, the development of bone, especially they're pushing to put in these IUDs with the levonorgestrel in young teenagers. And so that's the years of the teens, the 20s into the early 30s, or when we build our bone. And in order to build bone, you have to have estrogen. Estrogen is very key to bone growth, as is testosterone. And you don't get proper levels when the ovaries are shut down. So this is a huge concern. And what does this mean as far as breasts? We now have a study that shows, it was out of Finland very recently, that women who use this type of IUD increase their risk of breast cancer by 52%. I mean, that's huge. I mean, why are people thinking this is okay? This is not okay. We don't want unwanted pregnancies, but we can't prevent pregnancies by putting what are really toxic chemicals into young women's bodies. We need to change the talk. We need to get researchers to find methods that can prevent pregnancies without interfering with primary functions of the female body. We must remember always that reproduction is the prime directive of life, and it's interwoven with every other function of the body. You can't just give chemicals that shut down reproductive functions and think you're not affecting all the other functions. The thing is that these don't have an obvious rapid effect. We know that, for example, young women, if they're sprayed with DDT, which is a pesticide that has now been outlawed for years, but it's in the environment. It's what we call persistent. It takes like forever, like could take 1,000 years before it degrades. So everyone on the planet now has some DDT in them, but they used to spray for mosquitoes on beaches and such, and they would spray young women. They didn't protect anyone. They just went around, they just sprayed. And we now know that young women who were sprayed with this horrible pesticide, they had a much higher rate of developing breast cancer, but not the next day, not the next week. It could be 25 years later. So there's such a disconnect between exposure and then when something bad happens that people aren't putting two and two together. There's an epidemic explosion now of autoimmune diseases, depression, anxiety, gut problems, and I fear for the future for increased rates of dementia of different sorts, Parkinson's disease, Alzheimer's disease, and breast cancer. And what are we doing that may impact the women's lives, not tomorrow, but down the line, maybe decades later? We must think about these things. So we need to pressure to have research done to find safer, better, and efficacious ways to prevent pregnancy so that we don't have unwanted pregnancy, but we don't want to do it at the health expense of our young women. So thank you so much for joining me. I appreciate your time, your attention, your interest, and I'll be back shortly. I'll be back and we'll put the schedule up, and I will hopefully have some topics that you'll find interesting, educational, and thought stimulating. So have a wonderful night, and I'll be seeing you shortly. Take care.